All right, welcome everyone to today's webinar, Building Smarter Healthcare Facilities for 2025, Your Blueprint for Success. My name is Lindsay Brand. I am dRofus's Marketing Operations Manager, and I will be moderating today's webinar. Just to kick us off with a few housekeeping items. First off, mics are muted, so if you have any questions, please use the Q&A. And then we do have a couple call outs on this slide to let you know where the Q&A is in Teams. And then another thing to call out in the Q&A window, you are going to have two tabs. One is for all, and then another is for my questions. We will be answering questions throughout today's webinar. Some will be directly in the chat, and then some we will be mentioning out loud. And then we will have time at the end for Q&A as well. As for the webinar recording and deck, this is going to be sent out to everyone who has registered via email. So be looking out for that after our webinar today. I'm happy to introduce our speakers. Our first speaker is David Spehar. He is the Regional Sales Manager of the Americas for dRofus. He is a registered recovering architect, and he has 30+ years of industry experience, and he's passionate about transforming the built environment through data. Our second speaker is Matthew Bodie. He is the Executive Director of Planning, Design, and Construction for Baptist Health Jacksonville. He's still, quote unquote, practicing architecture, and he has 25 years of healthcare experience, and he's dedicated to improving environments for delivering care. As for the agenda, what to expect on today's call, first we're going to kick it off with designing for the future. Next, we're going to go over a brief dRofus overview. Then we'll be looking at the blueprint for success, which is really focusing in on the power of standardization. Then we will be going over a real-world success story featuring Baptist Health and Matt. And then at the end, we will have a live demo that really pulls everything together. And then, as I mentioned before, we will have time at the end for Q&A. So with that, I will hand it over to Matt.
Great. Good afternoon, everyone. Thanks for joining us. Really excited to be able to talk about dRofus and how it's been a benefit to us at Baptist. So, what I just wanted to express here at the beginning is, what are we up against? Why do we need these sort of things? And so the notion of smarter planning is really, really important in what we do. We're just growing and growing in the healthcare market around population growth, just trying to catch up the shorthanded doctors and nurses and team members. And so we've got to come up with other ways to be effective in what we're doing on a daily basis. And so I do work directly for Baptist Health internal here, and we are tracking all these things daily in our work. So outpatient services, especially, we're just rapidly pushing those out. We're not doing projects one at a time anymore. We're doing them 5 at a time and trying to track all those at the same time. So specialized care facilities as well, just key specialties around cardiology and neurology and the demands that they have in surgery centers. They all take just a lot of effort to stand up, and we need to be able to do that very quickly. And so those volumes continue to increase. At the same time, our technology base really keeps growing and growing. And, it used to be we talked about technology around imaging, and those sort of components that have a short life cycle and new ones coming around. But really the operational flow and capabilities around different AI elements, around the trying to increase the efficiency of the team members, those just become live things for us as well. So constantly working on that. The costs are just, they're astronomical these days across the board. Every time you think it's as high as it's ever going to get, it goes a little bit higher. So anything we can do to try to streamline that is favorable to us. So we are trying to figure out how to navigate those design trends. And so what we're looking at, again, is sort of modularity to speed up components, trying to see what we can do around telemedicine. It's not always just a built environment, but what's the equipment involved in that. Always looking for what's the best patient experience and workflow through that. Our regulatory requirements, they do keep growing and growing, and so being able to try to track those and apply those to spaces is very important for us, across sustainability, and really trying to find a way that we can be very intentional on the FGI and making sure it's built into our standards and not any sort of afterthought. So we stretch those muscles as well. And then just trying to get a hold of that cost. We're really the workforce cost is especially one that hits us here in Jacksonville and many other places that there's only so much that we have available, and so really looking to other opportunities to bring in material, to bring in product from other regions. So all of this ties back to a lot of information that we have to manage in some way in order to be organized and push it forward.
Which then kind of leads me to jump in. Hello, everybody. Thanks for joining. And Matt, thanks for kind of setting the stage here of kind of the bigger picture of what are the what are the overall kind of design and planning challenges that you see in the coming year. And I'm certain they're not unique to Baptist Health, right? I'm guessing most, if not everybody on the call, is experiencing a lot of the same pressures or inputs, if you will. And you mentioned about the amount of information, and if we translate information into the really the sheer amount of data inputs that everybody is getting anymore. So then this is now we start to talk about, okay, well, so you've got these challenges. How can we now start to address those and use the data that's available in a smarter way? And really, when we look at overcoming the challenges that we just kind of went through and how data can start to help, and again, we'll dive in a little bit deeper about dRofus as a database platform and what Baptist Health specifically is doing. But really, if we look at the challenge of the decentralized standards and requirements as part of this, so as a design or facility management team trying to get all your standards into one place continues to be a challenge. As I mentioned, I'm a recovering architect, and I'm really surprised by this many years into this that we still have this kind of siloed information. So how can we start to now use data to pull everything together in a more intelligent way? Once we can get all that data more accessible to our teams, we can now start to remove that reliance on institutional knowledge. You could see, both Matt and I have a couple of years on us, and would expect that many people in planning and design, there's a lot of knowledge out there, but how do we translate that knowledge from the more senior level people into the next generation? And being able to have that data centralized so that people can now start to make smarter decisions based on inputs from the more knowledgeable gray-haired or people is a benefit. Another big thing that we're seeing a trend with data these days is this ability to do a little bit more automation, and not necessarily with AI, although certainly that's going to be the next generation, but just being able to have consistent, reliable, structured data to help you now start to navigate and be more purposeful in validating regulatory requirements. We're seeing a lot of potential in that regard. And then another really big one now is, everybody wants to, have that common data environment, and how do we make sure that we increase collaboration? The reality is that the more that you can share data across your project teams, the better your communication is going to be. So, you don't necessarily have need to have a centralized data platform, but the more that you can start to connect your various platforms so that everybody that's using their own tools, that information is connected and passing back and forth, certainly helps that collaboration. And then ultimately here, the kind of the holy grail of this, if you will, is the reliable handover for FM, right? I mean, we all know that, operating buildings is what 80% of the total cost of a building. It really is amazing that there still is a lot of inefficiencies out there in facility management. There are a lot of expectations that BIM was going to kind of make it easier and better. I think the reality is we have to balance new technologies with the skill sets and the people that are actually using them on the facility management side. That said, we can't, abandon the idea that there is a lot of data available to us. So how can we make that structured and in an accessible way that these people downstream can use it? So these are the kind of the things we're going to focus on today between the case study of Baptist Health and just kind of an overview of dRofus is really starting to look at making teams more efficient, making the process more accessible, and improving the quality through the data and the interaction with it. So before I move on, we are going to pause at the end of each section just to see if there are any questions in the chat, because I know sometimes it's frustrating if you have to wait till the end.
No questions, David.
No questions at this point. All right, probably not, because we're just setting the stage. Once we get into the meat of things, I'm sure we're going to get more. So I'm going to keep talking for a bit here, and just want to give everybody, for those of you on the call that have never heard of the software, or those of you that may have heard it but are wondering what it is other than a funny name, dRofus, we're a Norwegian company. So at our core, we're requirements management software for space planning. And so what does that mean? So that means that really we are focused on getting all of that information together into one location, all that data that we just talked about, put it all in one location and make it more accessible. So when I talk about data, I don't want everybody to think about it in the traditional ones and zeros. Now, granted, we are a database, so that is the backbone, but people will tend to gloss over if you just start talking about databases. But the reality is, when we're talking about data in this context, it's really all of that knowledge and information that is available, like we've just been talking, right? So it's what's in the multiple Excel files, it's what's in Revit models. It's in notebooks. It's what's floating around in people's heads, that institutional knowledge, right? We really need to get that all into one centralized location. So when we start talking about managing data in the context of dRofus, it's really about collecting and managing all of that knowledge. So as I mentioned, we are a requirements management software for space planning. And because of that, everything in dRofus really kind of focuses around rooms. And there's 4 key components to rooms. But ultimately, the idea here is that we want to be able to capture everything that you know or need to know about every room in your project. Not only the room itself, but the stuff that goes into it, how the room functions, how these rooms communicate with each other. So we have an interface where you can gather all of that data or knowledge on a room by room basis, and then you can now start to tell a much better story very early on in your planning process through all of that gathered information in rooms. And we'll show you this in action in a little bit. So one of the really nice things about dRofus, and Matt will certainly touch on this when he talks about how they're using dRofus at Baptist Health, is the ability to template design. So you can template your design in multiple ways, right? So at the core level, you can create what we call room templates. And a room template is really a way for you to now start to drive your standardization. So we're going to pick on an exam room, for instance. So I can create a room template for an exam room, and I can predefine everything I need to know about that exam room. Be it code requirements, whether you're following FGI or state codes, your own organization's requirements for quality of finishes, for instance, and then all the stuff that goes into those rooms. So this could all be templated at a room by room basis. The next level of templating then that can be done within dRofus is this idea of templated design. And by templating design, what I mean by that is you can start to really you could pre-program or think of like prototype buildings. So you can say, hey, you know what, if I'm going to do a outpatient clinic or a mid-sized clinic or whatever the case may be, I can pre-program one of those. And I could say that if I have 3 of these, I need 2 of these. And this can all be templated so that that program can then be organized however you want. And the example I'll show you in a minute here is really kind of based a lot off of FGI, which, as we all know, is a fairly standard way of organizing the information. But ultimately, you can get a complete snapshot of your project inside of dRofus. And as you can imagine, if you plan all the rooms in a project, and if all of those rooms are planned off of templates, and all of those room templates know everything that you need to know about that room, you can get to a very, very high level of detail of knowledge about a potential building without a lot of effort, because all you're doing is you're leveraging, again, that shared knowledge into a single database that then can be shared with everyone. And speaking of sharing it with everyone, so we are a cloud-based solution, just like everybody else almost these days. And once the information lives inside of dRofus, there are multiple ways that that shared data can now start to break down those traditional silos we talked about, right? So whether you're part of the design and planning team that's doing the what I'll call the heavy lifting inside of the dRofus desktop, whether you're doing, you're an architect or an engineer and you're building Revit models and producing documents, we have a plugin for Revit so that that Revit data is directly connected to dRofus. Whether you're taking information out into the field, so if you're doing existing conditions assessments, if you're doing punch listing, you can take the dRofus data out in the field with you. You can snap photos, you can add QR codes. So again, what we're really trying to do is make this whole process seamless. And then ultimately, when you get to the point like Baptist Health, for instance, when you start to now create your facility-wide design standards, not only standardization in the means of this is what we want to make sure goes into our rooms, but data standardization. Now what you can start to do is create some very comprehensive dashboards leveraging that business intelligence. So we can start doing things like looking at trends across your hospitals, looking at things like cost on a room by room or square footage basis. So those types of things. So ultimately, the goal here is to get all of this data or knowledge into one location so that then we can now start to have all these discrete activities connected to each other. So before we move on and talk more about standardization before getting into actually the Baptist Health case study, are there any other questions or any questions so far, Lindsay?
Nope, but I do want to call out, if you do have a question, please use the Q&A. We would love to have this be interactive. So here's your invitation for the rest of the call. So thank you.
Excellent. All right. So, let's talk a little bit about standardization here. And again, this is a great quote. When you talk about, air quotes standards, many times when I talk to people, you think about the people that are responsible for managing the standards, which in most organizations, it's usually just a handful of people. But the reality is that those standards touch many more people than the ones that are just responsible for managing them. What's also the reality is that, when we talk about design standards, and certainly in the context of healthcare, it really is just the tip of the iceberg. And one of the reasons, and again, Matt will get into this a little bit more, that Matt chose to use dRofus as their platform for managing their facility-wide design standards was because of all of these cascading benefits that come from it, or all these cascading activities that rely so heavily on design standardization. And maybe, Matt, I'll just pause for a second and just ask you. So, if you look at this kind of the tip of the iceberg idea, and that, there's so many bits that go into it, are there any of these in particular that you would want to speak to that kind of jumped out to you at the beginning, that it's like, what? We really need a more robust platform to manage this aspect of the iceberg.
Yeah, I think the notion of design standards, if folks think about an organization or something that's been developed along the way, you think of Well, they've got all of it written down. It's on a website that I can click on. But that's really just a moment in time of when that PDF was printed and put in that place. And I think for what really gravitated us towards the dRofus is that it's a live communication of that design standards. And so all these elements can be tweaked and communicated through the rooms and programming, which I'll get into more as we talk into this. But so yeah, to me, it was a lot about the means of the communication, that it became a sort of a live discussion with our architects and engineers through the software.
Great, thanks. So what happened to my, there we go. So one of the interesting things that we find as we work with more organizations, and this was actually a really fun thing when we worked with Baptist Health several years ago, is that you come to the realization that when you start talking with a design and planning group within a healthcare organization, they're really trying to serve two different sides of the equation. So the first bit is that, most organizations have, many stakeholders, right? And each one of those stakeholders, they have their realm of importance, and each one of these things are equally important. But they all start to create a lot of information that will definitely drive what a design and construction group in a healthcare organization needs to produce as far as what I call, design standards. So if you think about the planning and design team, and I'm guessing most of you on this call kind of live in this world, is that you're probably communicating on a regular basis with all your stakeholders, and then you ultimately have a responsibility for developing system-wide design standards, equipment specifications, making sure that anything that you do meets code and licensure compliance. And then the biggest challenge is taking all of that information and then adapting it for your projects, right? Because, every project has unique requirements, unique constraints, but you have to figure out, of all of this information that comes from your stakeholders, what is close enough that you can make those required modifications yet still maintain the essence of those standards. And then ultimately, as a design and construction or design and planning team, you have the responsibility then of handing that information off to project teams and making sure that they're following those requirements. And then in the ideal world, you want to have this continuous feedback loop so that any modifications that happen in a project, be it that, a design standard has to change because you find repeatedly that, maybe a piece of equipment is the right piece of equipment. All of this now starts to create this really important feedback loop so that ultimately, as you're sitting in the middle of this, your design standards really need to be a living set of resources. And that's why Matt chose to go to a database solution instead of static PDFs or static documentation, because as he's learning lessons on his projects, they are modifying their design standards in real time, and they can automatically publish those to any future projects. So the idea here of design standardization works. And every presentation I give has to have either Legos in it or IKEA instructions, because I think there's nothing that speaks better to these complex topics than something like a box of Legos. I'd much rather buy a box of Legos that tells me how to put it together if I'm going to do 100 of them than trying to figure it out myself. So that's my own little personal Lego thing. And with that, I just have this quote here, and I'm going to then turn it over to Matt, who is going to then talk about what they've been doing at Baptist Health. Before we do that, Lindsay, I'm going to pause real quick and see if there's any comments, questions.
Yep, we do have a question, and it looks like Joelle did answer it in the chat, but I did want to bring it to everyone's attention. The question was, can we use data as a block with all clearance in AutoCAD?
Unfortunately, we do not work directly with AutoCAD. We have a Revit plugin, but we don't have something for AutoCAD. So unfortunately, no. And it's because Revit is a database as well. So that's how we're able to make that connection.
Yeah, we do within the Revit model, the families that we do, able to provide clearances and do those things through that, which is really helpful for sure.
Right. All right. And with that, Matt, I'm going to turn it back over to you. And it, another shameless quote from Matt in the presentation.
Yeah, that's definitely sped things up. So, yeah, as I started with Baptist 5 years ago. Prior to that was 20 years in the architecture consulting world, and back in those days, uh, you've got 100 questions you're sort of dealing with that you're asking questions. Engineers are reaching out to you to answer some questions on particular projects, and you're trying to get that communication to flow through a project. Well, move into the hospital where we have 300 active projects at any point, which it feels like I touched all of them in a given week, some weeks, and you multiply that 100 times the quantity of projects, and we're talking thousands of questions literally coming in across all sorts of things. So as I looked to see what Baptist needed and where to drive our transition, really, which is really what it was taking a system that had been built up. We were a 6 hospital system across the 7 county region here in Northeast Florida. And that evolution of the system was that we had grown up, and now we needed to further escalate in the years ahead. And we weren't at a position in design and construction to do that very easily in the old methods of the 1,000 questions coming in, the dealing with spreadsheets, the trying to email everybody across the board, trying to get architects, engineers, and designers to all produce something that was a consistent product for Baptist. And we had a lot of inconsistencies across all of our facilities at that point. And so all those things sort of drove together. It says, okay, we need to do something different, and how best to do that. And so had heard of dRofus with David in the past. We're both Clevelanders originally, and so reached back out to him to say, let's start digging in here and see where this needs to go. So they were really helpful in sort of the brainstorming part of this at the beginning, and what we could do and how we could get there. And so ultimately, what we want to do is what we've been doing for several years now is create our items, create our room templates, and allow the vehicle of dRofus to be the communication tool to our architects and our engineers on projects. And so we currently have about 700 room templates, individuals. There might be 20 different types of exams, based on different specialties and different things. They all come back to a larger quantity, about 3,000 or so items. If you flip a slide here, David. And so we built these 3,000 items. So what was that process like? What did we do? How did we get there? So there's other softwares out there that give you access to sort of anything you can buy in the world when it comes around stuff, medical equipment, technology, furniture items, etc. And the issue with that is that folks working in that, it's very easy to just choose anything that you see out in front of you. And we knew that was not going to help us in the long run. At the same time, we had a lot of cut sheets and sort of products that were being used across a couple dozen team members inside our hospital, and those were not being consistent either, because those groups were working in sort of their own little bubbles, each person. And so what we've done is we used the setup of dRofus as the real filter, and so it was a great work effort that streamlined us just getting the things that Baptist wants to buy into the database, excluding other things that we don't want. And that process was across equipment and furniture. And more recently, in the last year here, we've tackled the technology as well. And so all these items is really the basis of the stuff that we want to use. Each one of those, so you can kind of see on the screen there, it's got attachments in the bottom right there. And so we've got cut sheets in there, we've got cost information, and we actually built our own Revit families that we supply to these items. And so really a full house of components here with our budget dollars in here as well. So moving forward here, we really around sort of the how does this come about? So within this room type, here's a blood bank for example, and we've got these tabs of equipment. So equipment here that's preset based on our templates. Once we start a project, this can be modified, but it's a great starting point that we know what should be in there. We know what our history of the items that should be in there. The product data is right there. We actually we train our architects and our engineers to use the dRofus interface as well as the actual dRofus plugin that's in Revit as a way to grab this information and pull it down through the plugin. And they can actually pull these items with the Revit family and drop it right in. It's pre-tagged with our tagging system. They can immediately pull down cut sheets. And so doing that across equipment, furniture, technology, see artwork, signage, all those things are started with with what should be in those rooms. And the other big gap that we really were looking at to try to correct was what's on a drawing and labeled and what's on a procurement list, say from our medical equipment team internal, we're not matching. And that process of just trying to get those two to match, which one's correct, which one's right, who's got the right quantity, who's got the right product. Now the architects, engineers, and our procurement team who uses this software, this is their primary software, they are in there interacting daily on these projects. And so changes are tracked, quantities are tracked. And so our furniture team uses this fully. Our technology team uses this fully as their way to track projects. So you can see, like I said, 350 or so active projects, 170 users. Now we have about 30 to 40 maybe on the Baptist side. So a lot of that is architect, engineers, and contractors that all view and access this information. And we are planning a lot of projects and a lot of dollars through this across the board.
So before we move on to the next, the demo itself, I'm just going to ask you a couple of questions, Matt. So you mentioned like the 170 active users and that you've got, most of those are architects and engineers that you're collaborating with. For everybody on the call, can you kind of explain to them a little bit about how this has changed your interaction with your design consultants and how it hasn't necessarily changed their workflow or their process? It's just kind of giving you a little bit more transparency into it, and what type of feedback you've gotten from them.
No, great question. And yes, it absolutely changed. In previous sort of versions of trying to run through a project, you're starting with maybe a program document of which this does for us. Then you're going through designs and you're trying to create the rooms, and and at some point far down the road, you're like, okay, now my medical equipment team needs to be involved, and they start from zero, starting to build up these lists. And that's the same thing for furniture and technology, all these things, right? And what we're able to do now with that initial program is that the architects, engineers, yeah, we may change 5 or 10% of this, but they've got the 90% of this is what these rooms need. And they're immediately sort of understanding the elements in that room. And my short answer on most emails these days is check dRofus, it's in there, right? And as we've been doing this long enough, our architects and engineers know that that's where they go before they ask a question. They know that that's where the information is. The one tab at the end here is noted as construction, and that is items that the architect and engineers are historically and still on our projects are responsible for, and that's around, it could be sinks, it could be a particular piece of millwork, it could be all sorts of things. And that's, again, information that we're giving to them early on that they can then apply in their way within their team. And so, yeah, I think from their workflow, they're getting equipment that's the right size, dropped in with the right label on it. That helps everybody, right? That takes a big piece out of it. And then from the construction side of things, they're getting flooring information. They're getting other bits of data from us early that they can start to run with. And at the same time, we're using that as a platform to standardize that.
Excellent. Thanks.
Before we move on, we do have a couple of questions that came in. The first one is, do you need to use BIM when using dRofus?
No, you do not. And actually, I believe, Matt, you were quite a bit into the implementation before you even started looking at the Revit side of things, right?
Yeah, we knew we had to build up the database, and that took some time, and we had to train up our equipment folks to be comfortable working in it, and so it's probably a year process of sort of just working on the setup and all that. And this is, gosh, what are we, 4 years into our journey here? Yeah, so I think you definitely can use it as a communication tool. There's all sorts of reporting options that you can kick things out of this to use as that communication, and folks can log in. The Revit component is really what drove us specifically to dRofus, that we really find a great value in that part of the communication, but it standalones by itself as well.
Great.
Great. Next question is, how does dRofus support the capture and application of lessons learned and best practices from past healthcare projects to improve future facility planning and design?
So I'm going to let you handle this one, Matt, but I just want to say that the one thing that I really love about this, being a recovering architect, is that I was always amazed that every single time we would start a new project, everybody acted like it was the first project they ever built. And so I'd like for you to speak a little bit to how you've kind of overcome that. Hey guys, we've done this before.
Yeah, absolutely. So the way that the items that roll into templates, the way that dRofus has this organized is, so we get to the end of a project and we realize we are never using that flooring again, or we should always be using this one, it's working right, or that piece of equipment just didn't do what the users wanted to do, or furniture. And so what we do is we go back to that particular item. I've got an agitator platelet, super exciting thing here on the screen here, and we will put next to it discontinued. And so that automatically, with any of the current projects that are in design, which could be hundreds of projects, anybody that's trying to use that, it will pop up automatically in their list that says discontinued. And so our equipment team folks will then be working through project by project to, what do we want to replace that with? They can do it at the template level, or they can go project by project and understand what that change is. And so there's a flag. We do the same thing with flooring, or we can just change that and say, cut that off of surgery floors. We're going to use this product instead. And that will then again update through the construction. So that's where I talk about it being a live standard, that we're not updating a book or sending an email to somebody or communicating it that way. We really can update these standards. And then, we work with a fixed number of architects and engineers, say, 15 different groups, and they're trained to how to look at these things.
Great.
Okay,
Lindsay,
perfect.
I'm going to do a quick time check. I'm going to do a quick time check and move on. If there's any other questions, we'll grab them at the end.
Yep, exactly what I was going to say.
Yep. These are great questions, by the way. Good to hear. I'm so glad we're not just talking to dead air. All right. So with that, I'm actually going to just hop into dRofus, and I'm going to spend a few minutes here and just walk through just a real high level overview and touch on some of the things that we've talked about thus far. So this is the desktop application. There's several different modules. So we organize how you access the information inside of dRofus through these modules. So the first thing I want to do is open up the templates module. And inside of here, this database that I have, everything is set up and structured around FGI and the 2022 version of FGI. So one of the things that you'll first note is that if I go to this templates module and I hit this little drop down bar, I have all of my room templates organized by the FGI room classifications. So if I go ahead and I'm going to pick on that exam room and I'm going to isolate my diagnostics and treatment room templates, and now I can see that I've got 50 room templates in diagnostics and treatment. If I go ahead and I select that exam room template, first of all, before I open it, you'll see that the interface here We present you with a lot of information. It's really customizable so that you can tailor what you're seeing based on what your activities are for the day. But you'll also notice that it's a lot like looking at a spreadsheet and just tabular data. But if I go ahead and select this exam room and open it, the first thing, and again, this is a room template. So the first thing you'll see is a few pieces of information. One thing I want to note is the standard area. So you can predefine your standard areas so that every time a room gets planned in a project off of a template, it's automatically going to know how big it is. In this case, exam room based on FGI, 120 square feet. Just real quick note here of these different classifications. These are ways how now we can start to structure this information for handover at the end of the project for facility and asset management. These are the types of classification systems that we have an open API, which means we can talk with other softwares. We can now start to push this data directly into FM platforms. The next thing I want to focus on briefly is the room data interface. So as we were mentioning earlier that, room data is kind of one of the keys to this, where you can capture all the design and functional requirements for rooms. A real common theme throughout the software is that everything is customizable. So one of the things that we do with all of our customers, and Matt he kind of briefly spoke to this, we have kickoff meetings, we have workshops, we really dissect your process, we understand what your deliverables look like, and then we will focus on structuring all of this information based on the information that's important to you, and it's organized in a way that you want it output. And I'll show you some examples of outputs in a moment. But you can see that in here, we've got this data all set up again, general FGI requirements. You'll see we have a lot of different ways of inputting information, drop-down lists, free text, whatever the case may be. I'm going to go into this next construction tab. Now we can start to identify things like what are our STC ratings of walls, etc. You get the idea here, right? That this is just a one-stop shop, if you will, to now start to capture all of those design and functional needs for each room. This information can evolve. So another nice thing about dRofus, and I think another nice thing about the way that Baptist Health implemented it, is that they kind of did a first pass and says, okay, well, we know we want to standardize these room types. So let's just create 700 room templates for all these different room types. Now, do we know exactly all these pieces of information right away? Maybe not. Do we know every piece of equipment that goes into them right away? Maybe not. But we know we want to template them, and then that information, it's a living thing that you build on, okay? You'll also see the ability to attach images and documents. Again, another common theme throughout dRofus. So you'll see that you can attach images and documents to pretty much anything in the database. In this case, this exam room, I've built what I'll refer to as a shoebox model of this exam room in Revit. And as I click through these views, these are actually views coming out of a Revit model, and everything inside of the room, all of the equipment is, as Matt mentioned earlier, each piece of equipment in the room is connected to an item in dRofus, and those Revit families have a one-to-one relationship. So as you're starting to share this information with your design consultants, whether you have the luxury of giving them your Revit content that's connected to your items, or letting them use their own, you can always connect their content to your information. So you always have that kind of breadcrumb trail, if you will. We can attach documents. So if you have any type of legacy information in your organization, old PDFs or design standards that haven't been translated yet, you can attach those to these rooms, and all of your consultants have access to them. These next few headings across the top, these are what Matt was showing you earlier in his context. So I'm showing you the equipment item list for this exam room. So you can see all the pieces of equipment, quantities, cost, etc. You'll notice that my layout is different than Matt's. Again, this is something that we work with everybody to determine what's the most logical way for you to parse out responsibility, essentially, for planning what goes into the rooms. Right. So now I have a one-stop shop here of everything I need to know about an exam room from a design standard standpoint. And you'll see, I'm not going to get into the details, but we log everything. So any change that's made, so the questions or the comments that were made about, well, if we need to change a piece of equipment, or if we need to make a change because of some situation that we're realize we want to do, A instead of B, those changes are all logged inside of the database, and you can see when those are done. So you can publish those to your consultants. You can also print directly out of dRofus. So you'll see that we come with a lot of pre-loaded reports. I'm going to switch over here real quick like a cooking show and show you what a room data sheet looks like. So if I can get this to open. So this is an example of an out-of-the-box room data sheet. So this is coming directly from that exam room. So this is a nice sample facility design guideline for an exam room. You'll see basic room information. You can include QR codes if you want. We have that web application that I mentioned where you can bring the data out into the field. You can actually snap a photo with that with your smartphone or a tablet, and you can actually bring that data up and edit it right there in real time. But you'll see that here's all the information about this room, and it's organized by these gray headers that represent those different tabs in that interface I was showing you. So one of the things we will do is work with you to basically reverse engineer how do you want to present the information to your constituents, right? But you could see that we've captured all those requirements. In this case, where we're referencing FGI, these are live links back to the tables in FGI. If you have a subscription, you can access the data directly through FGI. And then ultimately, then you'll see or not ultimately, but you'll also see that you have all of your item lists. So you can now print not only all the room's requirements, but here's everything that goes into it. You could include cost if you want. And then finally, you can actually include all of those images associated with that room. So now I have a very concise room data sheet that now shows me everything I need to know about an exam room as my design standard. Obviously, you can publish these standards if you want. Again, in the case of like Matt, you give your consultants direct access to the database with the correct permissions, and they don't even need to look at a published PDF. They can access the data live. Here's a quick example of a customization. So this is for a large healthcare client in Australia. We can pretty much do almost anything you want with these room data sheets with customizations, right? But most people are very happy with tweaking the out-of-the-box format, okay? I'm going to move on real quickly now and go from my room template to talk a little bit about items. So as Matt had mentioned, as they showed in his screen capture, they've populated any item that they will need to purchase and install in their buildings, right? Those items get organized in this item grouping structure. I'll say it's arbitrary, but it's essentially your way to figure out how you want to quickly navigate thousands or tens of thousands of pieces of equipment that you may need. So you can organize these as however you want. In this case, though, I'm going to isolate my fixed clinical equipment, and I'm going to pick on the exam chair that's in that exam room template. And if I go ahead and open this exam chair, so now I'm looking at that item information. So like Matt was talking about earlier, here's where you can start doing things like putting in budget prices. You'll see this BIM ID and this to be modeled checkbox. This is now how we start to create a connection to Revit content. So what this means for you as the owner is that you are now going to tell your consultant, every time I plan this exam chair in a room, I want to see it modeled. And I want to make sure that now my quantities in your schedules in Revit are meeting my requirements for procurement. So you get that connection. You'll also see classifications down here. Again, another way to connect to FM and AM systems in the future. And then this equipment tab, just like the room data I was showing you, this is now the item data. So you can capture as much information as you want about your items, power requirements, layout requirements. This is contextual. If I'm looking at a piece of furniture, I'm not going to see all of this. I'm going to see fabric selection, things of that nature. And just like the room template, I can attach images and documents to this. So similar to like what Matt said, you can actually upload your Revit families if you have that content, and your consultants can download it directly out of the software. And they can download it directly inside of the Revit plugin as well. And finally, I'm going to now show you the last, before I move on, I'll show you an example of a equipment specification that comes out of dRofus. Oh my gosh, come on. So this is another example of an out-of-the-box report. So this would be an equipment specification sheet. Again, just like the rooms, you can attach QR codes if you want to be able to allow people to access this information digitally. But again, just another way of organizing all of that information into a nice, quick document that you can share with your design consultants, you can share with your internal staff. And then you also see the ability to then attach products as well. So to Matt's point, if you start, changing out products, you can say, hey, well, this one's obsolete. We're now using this one. So there's a lot of ways that this information can evolve. The last thing I'm going to show you here before we jump into the Q&A is then how it all comes together in the rooms module, which is where your projects live. And as Matt mentioned, he has a database, and inside of the database, he has all of his room templates, he has all of his items, and then he has, 300 and some projects that are running concurrently. Matt's internal team will go in and plan their projects, and then they invite their design consultants to collaborate on that information as they're building their Revit models. But this is an example of a pre-planned hospital. So as I mentioned earlier, that not only can you standardize room templates and your equipment that goes into those rooms from a design standard point of view, but now you can create essentially prototypical buildings. And now you can start to assemble all of those room templates and all the stuff that goes into them into a prototype, or you can just plan them on the fly. It's really up to you. But we give you different ways to now create those multiple levels of design standardization. And with that, before we jump on, I will show you one other export, which is a program, because many people usually will have some version of a room program that may look similar to this. A lot of times people actually start with an Excel file for a program, which, by the way, we can import very easily. One of the ways to easily populate the data is to import from Excel. But once you start creating this data structure that we're talking about and standardizing how you organize the information, and again, in this case, this database is organized based on FGI's room classifications. Now these programs become much more intelligent and much more interactive. So instead of just looking at an Excel spreadsheet of my program, I can now start to sit down and dive into the specifics, right? So I can isolate my diagnostics and treatment and my emergency services. And now I can quickly look at what I've programmed in my emergency services department. So there's a lot of ways where you can start to slice and dice the data through reports, through exports, or connecting it to the BIM plugin. And with that, it looks like we're almost on time here.
Good job.
Thank you. So we will go back to our Q&A and see if we've got anything in the queue there.
We do. So first question is, how can data-driven design facilitated by tools like dRofus help healthcare facilities adapt to evolving patient needs and new medical technologies?
Ooh, that's a biggie. That one, that's a meaty one right there. Well, I will just say from our end, technically, one of the things that we're seeing a big trend in now is our clients are aggregating all of the data in their dRofus databases or their dRofus projects into Power BI. And people are doing some really, really intelligent analysis and looking at the data to now start to see trends or start to drive trends based on what they're seeing across their portfolio. So technically speaking, that's what we're seeing. Matt, I don't know if you want to add anything to that.
Yeah, I think just at a sort of a micro level, we've got 6 different hospitals, so we have 6 different cardiology directors, right? At all those facilities. And when they start talking about, I want this product, I want this product, well, that doesn't line up. We immediately see that doesn't line up with these other products that are out there. And we have made light years worth of advances on being able to, in our medical equipment team, streamlining this set of pieces of equipment. Now we could do more bulk buying on that and bring our costs down around that. I used to have 8+ interior designers working for all different firms. All the things were good, but they weren't consistent and they weren't giving us any chance to drive the cost down. And so now we run our entire, you saw all those projects listed, we run our entire furniture purchasing through 2 people in my office, and that's the only people that plan furniture and help to procure that. So all those things build up a potential to sort of just be more consistent about what's coming and being able to pivot quickly on what that new product is.
Did that answer the question?
Yeah, absolutely. So that's actually a good segue into the next question. The next question is, can you create equipment schedules in dRofus?
Matt, you want to handle that one? You guys do it on a daily basis.
Yeah, definitely. So we sort of work under, David's absolutely right that Excel things in and Excel things out can work all day long very easily in that. We sort of work on a stay away from Excel mentality. Just the notion of our team members working in dRofus. We pull dRofus up while we're in a user review meeting or design meetings, and our purchasing team there, and they're making edits on the fly. And so their sort of equipment schedule is really just the interface of dRofus on that particular project. And so they are able to, one of the things, and David touched on it, is sort of the headings that you can view at that time. Any bit of information that was within there, you can pull that as a column that you're looking at while you're reviewing that. And so depending on the topic, and maybe there's a column of lifespan or something, and so you can pull that up and sort of approach it that way. We've also managed existing versus new versus future. We want to plan for it, but we're not buying it yet. And those all total up as well. And so we're managing all that right through dRofus as well. So yeah, it's been really helpful to work it that way. You can always print out a PDF, always export Excel, but we just work right in there. We go straight from there to ordering the equipment.
Great.
Excellent.
Thank you. So we do have time for just a couple more questions. One is, what best practices do you have for transitioning from a paper-based to a database approach? And that's for Matt.
Yeah, I can,
Sorry.
I think let me say it this way. When I started 5 years ago with Baptist, they were on, I think, 2010 or 2008 AutoCAD, where they had to send out drawings and have somebody upgrade them and send them back, or downgrade them, I should say, and send them back. And so we knew we had a long way to go, and we immediately implemented Revit. And what I haven't mentioned in all of this is we built all of our models. We built Revit models of our entire system, all 5 million square feet roughly, in Revit. And every single one of those rooms is linked to a dRofus room. And so we use dRofus as our existing database of existing facilities, and we can run reports off of it there. And so it took hours and time, so dedicated resources, and just really that sort of organization. So, trying to do this with team members that are already loaded up, I actually brought on new team members to help administer this and set it up. And so but that has paid itself off, again, just on furniture ordering. It's paid itself off in spades, many times over. So, but yeah, it's a process, and you sort of have the ability to do it one chunk at a time. And we got furniture working, then we got medical equipment working, and then in the last year, got technology working. So you can kind of slice and dice it in different ways.
Great. We have 2 minutes left. So this one, if we could just keep it short, but I think it's a good one. Where would you say you've seen the biggest cost savings in your process, Matt?
Yeah, I think the cost saving piece has come through our standardization around medical equipment and furniture component to it. From a time/headache perspective of it, those dollars come into our architects, engineers knowing things earlier, and they're not spinning their wheels going back and forth as much. We're not having to manage all that at too much effort in those things. Those things all, as we've gotten through, I think we get great fees and great product out of our designers, and we are able to be more consistent about what we're actually building on the construction side as well, because everybody's on the same page. So there's cost savings across all those things.
Awesome. Thank you so much. So just to conclude, before I let everybody go, just wanted to call out this resource that we have available. So this is our latest ebook, The Ultimate Guide to Improve Healthcare Facility Planning. This is a great supplement to today's webinar. You can access it via the QR code. And then just as a friendly reminder, this presentation deck and the recording will be sent out via email after today's webinar. And if anybody is interested to learn more about dRofus, please feel free to click the link that's available in this last slide. We'd be happy to get back to you. And with that, thank you so much, Matt and David. You did a great job. Thank you again, everybody, and hope you all have a great rest of your day.
Great. Thanks, everyone. Thanks, Matt. Bye-bye.